to be a personal care worker when they can go to Woodman's and bag groceries for $12 an hour or flipping burgers for $13 at Culver's. I have many friends who have found workers for this pay rate, but the workers are unreliable. I've had friends that have been left in their beds for days on end, or workers that didn't show up or missed their dinner or essential medications for the same reason. I'm asking legislators to approve the Medicaid expansion, not only because Wisconsin taxpayers have already paid in, but because every Wisconsin citizen deserves the right to live a meaningful and safe life. The time is now to finally listen to the people and accept the Medicaid expansion. Thank you.
Wesley.
I'm Amber Wesley
Eau Claire, Wisconsin.
from Eau Claire, Wisconsin.
I'm going to my iPad to speak.
I'm going to use my iPad to speak for me.
I was valedictorian of my high school class, graduate of UW Stout, former Miss Wheelchair Wisconsin 2013, and I'm also a self-employed graphic designer for my own business, Beautifully Different. In my community, I work with advocacy groups and participate in adaptive sports like wheelchair bowling and wheelchair power soccer. I am an intelligent, active, successful and healthy young lady due to Medicaid-funded programs like IRIS. Some of the greatest benefits of the IRIS program is that I am able to choose, hire, and schedule my own personal care workers. These workers help me with cares that I am unable to do myself, like showering, shaving, brushing my teeth and hair, feeding me meals, cooking and cleaning. They also take me to my appointments, grocery shopping, my activities, various errands, like picking up my medication and yes, even the bar. This is Wisconsin after all. These personal cares are just that, personal. Therefore, finding reliable, flexible, and caring people is extremely important to me. Basically, they have to really care about their job and me. Being able to pay them a livable wage is a huge aspect in the search for good workers. Having good workers allows me the freedom to choose when and where I have my cares done. A great freedom that most people take for granted. To some of you, this may be just about budget or politics, but to me, this is my life. I'm asking you to put yourself not in my shoes, because most of the time I choose not to wear shoes, but in my seat. I did not choose to have a disability, and I did not choose to need these programs, but you can make a choice to improve them. Make the choice to accept the Medicaid expansion.
Thank you. Thank you, Amber. Thank you, Jason.
And now we're going to hear from Cheryl Homiak from Madison. And Cheryl is a family provider to her daughter.
Most people are sharing with you today the specific concerns they have about Medicare expansion. What I want to give you instead is, from a parent's perspective, the joys and trials and experience of being a caregiver for a daughter and so that you will be able to begin to have a feeling of why these supports that people are needing and advocating for are so very important. In 1985, a wonderful little girl named Rachel came into my life, and I became her mom. She was 6 years old at the time. She turned 40 last December. Rachel is blind and has severe developmental disabilities, so she will always need 24/7 care and supervision. Being Rachel's mom and primary caregiver has had its challenges and hard times. There have been times of great concern when she has appeared not to feel well, but hasn't been able to communicate her problem. There have been periods when she has engaged in self-injurious and aggressive behaviors, which led me to place her out of home for 3 years until I realized that nobody else had any better solutions than I did, and so brought her back home. There have been times when her sense of day and night was confused, and the only remedy was to keep her up as long as possible, put her to bed, and repeat this cycle until her sense of time was back in sync, which meant I had to be in that cycle too. There have been times when I have felt totally inadequate to be her mom and her primary caregiver, but I am her mom and I am her primary caregiver. And without the stresses and anxieties that go with that, there wouldn't be the deep joy and love that also has grown between us through the years. There have indeed been many lighthearted moments and times of great joy. There have been the times when her giggles over some small joke, or just because she was having fun, have had me bursting out in laughter with her and feeling an underlying deep contentment because I knew she was happy. When she sings, "You Are My Sunshine," or asks to go to church and sing and praise the Lord some more, I would not trade caring for her full time for any other job in the world. And when we sing through our nightly bedtime routine, all the stresses and difficulties of the day are at that moment reduced to insignificance. No man or woman or family is an island, and obviously I have not been able to care for my daughter by myself. We have had so much support for which I am constantly thankful. We have friends to go out with who know the unpleasant and even frightening behaviors that Rachel could possibly exhibit, and yet totally accept and enjoy her. These friends are there to lend a listening and sympathetic ear and encouraging words when I need to vent my frustrations and fears. Rachel and I both received Social Security on my work record. Had this not been the case, I could not have continued to be her primary caregiver, but would have had to work full-time outside of our home. We receive support services from agencies here in Madison and through Rachel's IRIS funding. Through Community Living Alliance, Rachel also receives services and I receive pay for doing some of her cares, though I do not receive the wage that a non-family caregiver would receive. Rachel also has other caregivers who share with me the challenges and joys of caring for Rachel and allow me to have some time spent away from her, or at least time when I don't have to make all the decisions and carry out all the tasks on my own. These caregivers also give Rachel some time away from mom. Without these services, supports, and funds, I would not have the resources to procure services for Rachel and would not be able to stay at home and care for her. Without these supports, I am sure she would have had to be placed out of home permanently years ago. Above all, I constantly thank God for his love and guidance and provision and encouragement every day of our lives, without which Rachel and I would never have become a family, and by which we have been able to continue together for over 30 years. Many people become family caregivers out of necessity. There is simply nobody else to provide what is needed. There are others who very much want to care for a loved one, but would not be able to find the needed services and funding and would not be able to make ends meet on just the wages paid for caregiving. I had the privilege of being given a choice. I could have continued teaching or worked in technology, which I greatly enjoy. But adopting Rachel was a door full of promise that was opened to me, and I considered the funding and support to care for her myself at home to be a continuation of that open door and a great blessing. I will always be Rachel's mom. To be able to continue also to be her primary caregiver is a privilege and a joy I am glad that I can have. Someday it will be time for her to move on to a home setting where I will not be her primary caregiver any longer, and I pray that she will continue then to thrive as she does now. Until that day comes, I am grateful that I can care for her, and I rejoice in the love I have received and have learned to give. I believe that at the end of my life on earth, I will look back and be satisfied and joyful over the way these years have been spent.
Thank you, Cheryl.
As you hear each of these personal stories, I urge you to take a look at that chart over there that shows that every single service and issue that you are learning about today from these folks who came from all across Wisconsin is being funded by Medicaid expansion funding. That's why this is so critical to us today, because without Medicaid expansion, a lot of the things that people are asking for today are not going to be possible. Medicaid expansion savings would be used to fund $44 million in increased dental care reimbursements, including for those with people with physical and developmental disabilities. Dental access is a critical issue for people with disabilities in Wisconsin. About a third of people with disabilities say that they had to have a permanent tooth removed in the last year. And people with disabilities are more than twice as likely to say the only time they go to a dentist is when they are in pain. Today, to talk about this issue, we have Cindy Bentley from Milwaukee and Aaron Miller from St. Francis talking about what members of People First Wisconsin across the state experience.
Good morning. My dentist had retired. I got a call from Missy, our Special Olympics office. She is in charge of the Healthy Athlete program. She asked me why I was not smiling. So I told her that my jaw hurt. And there was some problem with my teeth. And I didn't feel confident. I was embarrassed to open my mouth because my teeth didn't look good. She asked me if I was interested in Mercy Care, which we went up to Fond du Lac. They are a lot of dentists from all over the world, all over the state, including Marquette University. Mercy Care, which has dentists from everywhere, including Marquette University. So they help people who are in need but don't have insurance. I had insurance but didn't have anyone in Milwaukee who would take it. I needed a dentist badly, so I went to an oral surgeon where I lived. He suggested I see Dr. Mike. From Dr. Mike, he suggested I go to Marquette University Dental School, and Marquette referred me to Dr. Brooks. She has done 3 jaw surgeries for me. Brooks was the oral surgeon, and then Marquette for the dental, which I'm very thankful for. Which is wonderful. But the process started to finish took 2.5 years of being in pain. In closing, I want you to know that a lot of dentists just pull out person's teeth, and that it is a true story. They just pull them out, and that's it. People with disabilities need to have their teeth and not to be hurting. Imagine what it would be like if it happened to you. If you couldn't eat good food and have no way to fix the problem. It was not for Special Olympics. A lot more people with would not be able to get dental care. So I just wanted to, I should have put that in here. So Special Olympics, Wisconsin, and in the 92 countries, they have a, it's called Special Smiles program, which athletes go to state games, they check the teeth. So I wanted you to know that. It was not, like for Special Olympics, we would be able to get dental care because all over the state, dentists don't take Medicare. And thank you for listening. The executive director of People First, please understand about dental care for not only people with or without disabilities. I am so glad that I can now smile and my jaw doesn't hurt as much. I have one more surgery to go through, but thank you for listening.
Thanks, Cindy. And as Cindy said, you can hear people who use Medicaid for their dental care across the state are really suffering because there aren't enough providers who take Medicaid, and as a result, people are in chronic pain every day, and they're also having to have teeth pulled unnecessarily because that's the only care they can get. So really important story about how expansion could help improve dental care for people with disabilities. More than 1,000 children with significant disabilities are currently on a wait list for children's long-term supports in Wisconsin. This is the kind of program that can help with fencing around a yard for a child who might be a runner. It helps with assistive technologies. It provides important respite services so families can take a break. Right now, more than 1,000 children, and you can see around the map, county by county, the number of families and children who are waiting. The Medicaid expansion would bring an additional $39 million in savings into the state of Wisconsin, and we could finally get every single family and child off the waiting list. So this is a really critical improvement that Medicaid expansion could bring. And so I'm going to introduce now Cassandra Balin of Janesville, and she's going to talk a little bit about what it's like to be told in your county that you're on a 10-year wait list for children's long-term care, and what sense of crisis that can bring to families in Wisconsin.
Thank you. I'm so honored to be here and talk about my family's experience with the long-term waiver program. My son James was born in 2013, and as James got older, it became clear that he had some delays, but we had hoped that as he worked with the Birth to 3 program, he would make gains. In 2017, James received a diagnosis of autism and global developmental delays. Even though we had been moving towards his diagnosis for over a year, it was still a shock and caused many sleepless nights as we pondered our son's future. We dove in doing research and finding out what services would be helpful for James. One of the services we learned about was the long-term waiver program. We were so hopeful to access this program after learning about the assistance it could provide. James is a very active young boy and loves to be outdoors. Unfortunately, at the time, we lived in a home that did not have a fenced-in yard, and because James has no sense of danger and would run in the road, he was not allowed to play outside as often as he would like. We also couldn't have a pool in the yard, not even a small wading pool, because James would jump in with no regard for safety. We had hoped the waiver program would have been able to help us get a fence and swimming lessons in order to provide James a semblance of a regular childhood where he could play outside and swim in a safe environment. While we were thrilled when we were told James qualified for the program, we were devastated when in the next breath we were told the wait list was 7 to 10 years. We had hoped so much to access those services to help provide James a regular childhood, and we were told he wouldn't be able to get help until he was 13 years old. After some additional research and talking to others, we found out that the wait list in Rock County at the time was 2 to 4 years. That became a deciding factor in my husband and I's decision to move to Janesville from Pell Lake. We decided to leave the community we had built around James and further away from our families for the chance that James would be able to access the waiver program almost a decade earlier. As we settled into Janesville, the legislature funded the program and we were able to get services starting about 6 months ago. Since then, we have been able to get funds to get tools to address James's significant sensory issues, My husband and I were able to attend a conference where we learned about more programs for James and met other families like us, and we are currently working on getting James those much-needed swimming lessons. In addition to these services, we also receive respite care. As James gets older, his developmental delays become more obvious and more difficult to handle on a daily basis. Respite care gives my husband and I a much-needed break to make sure that we are providing James and our daughter a secure foundation for them to grow from. As the legislature debates on whether or not to expand Medicaid in Wisconsin, as a mother who has been there, my heart hurts for those families just receiving their diagnosis and thought that they would be able to get help right away, and are now being told the money is no longer there and they have to wait until our children are a priority for the state. Thank you.
Cassandra, thank you for sharing your family's story and you and your son and how much the waiver has meant to your family. And just wanted to remind people with our map that over the state, over 1,000 families, just like Cassandra's, are waiting, and children grow up quickly. They can't wait to get the supports that they need to utilize their full potential, and Medicaid expansion would have the potential to help families like Cassandra's realize that dream. Another very important area in the budget is investments for mental health. The governor's budget invests a significant amount of funding, $113 million in mental health supports, and that's made possible because of Medicaid expansion. These investments are so greatly needed. 49 of Wisconsin's 72 counties are mental health professional shortage areas. In the work we do at Disability Rights Wisconsin, we hear from families every day how difficult it is to access mental health supports. The budget includes some very key investments that could make a difference for so many of these families. This includes increased Medicaid rates for physicians and clinics providing behavioral health clinics, which will improve access to those vital services. Funding for 5 regional crisis stabilization centers. These would provide regional alternatives to the current practice of transporting people experiencing a mental health crisis hours across our state at great personal and fiscal cost to receive services at the state Winnebago Mental Health Institute. This would provide an alternative that would be ultimately less costly and better for people. The budget includes state funding for Medicaid crisis intervention services that are provided by counties. Counties are struggling with the cost to provide these services. This would provide additional funding and make it a shared responsibility with the state, as well as serving people in crisis who have an intellectual disability, substance abuse concerns, or dementia, which is so important given our aging population. Finally, the funds will also address the substance abuse crisis in our state by funding integrated medical health homes that will serve as hubs equipped to treat a full range of substance abuse disorders, including medication-assisted treatment with methadone. We're very fortunate to have with us today to share some of the personal perspective on the need for these services, Mary Neubauer from Cudahy. Mary is a certified peer specialist. She is the public policy coordinator with Mental Health America, and she is a fierce advocate who brings so much experience to mental health advocacy. Mary?
Good morning. I'd like to share a few stories. Winnebago isn't centrally located for all counties in the state of Wisconsin. I personally live in Milwaukee County and was transported to the Milwaukee County Behavioral Health Division in the back of a squad, handcuffed. But there's many, many people that get transported to Winnebago County and take a 5-hour drive in a squad car, often handcuffed in the back of the squad, to be treated at Winnebago for 24 hours, be released and take a squad car 5 hours back to the county they come from. and it's not a very efficient process. It's not a friendly process for the individual who's experiencing a mental health crisis, and it's not cost effective. It's not the way we should be treating people with a mental health crisis and what we should be doing with people in our state and our community. And in the proposed budget and in the expansion for Medicaid is the opportunity to build 5 crisis stabilization houses or centers across the state. And these 5 crisis stabilization centers would be places where people that are in crisis, and we have some similar facilities in Milwaukee County, where people that are in crisis could be taken and mitigate the need to be taken to Winnebago. They would be able to get services there and be triaged and treated. We don't know all the details, but if we don't have Medicaid expansion in the budget, we don't have the opportunity to treat people more humanely and with better care and better services and better options. And everybody doesn't need to go to the hospital. We can do things differently. I've been involved with state programming for about 18 or 20 years. So I work with people from all around the state, and we talk as peer specialists and advocate and policy people. And the options that are in this budget are options that really talk to people's hearts. It talks to people's hearts about being able to do things different and to do things in a more civil manner and to make things work out better, and putting kids in squad cars. So those are 2 of the areas. And in the other area that I wanted to talk about 13 years ago, my psychiatrist of a long time had left, and I had to find a new psychiatrist, and ran into the rate setting issue. And because the rates were so low, I went through a list of 12 psychiatrists before I could find a new psychiatrist. So the issue of the expansion of the Medicaid rates for physicians and medical providers, clinics, and service providers within providing behavioral health services is truly necessary in order to improve access. So we're talking about a basic principle of improving access. So I thank you for the opportunity, and I hope the legislature looks at this and sees that these are very critical steps and very important for the well-being of the people of our state. Thank you.
Thank you, Mary. Kind of tight quarters here. Medicaid expansion, as you can have heard this morning, really impacts so many different types of people, so many people across different walks of life in Wisconsin. And one of the groups that is really could be impacted by expansion are families who are working right now and who could work more and still provide health insurance for their families. We know of many, many families who have left professions or left full-time jobs because of caregiving needs, and because as you heard this morning, there are no other people who can do those cares. So we're going to hear next from Anna Stevens in Madison and her son Xavier. She's one of those people who is using Medicaid as a health insurance and has had to leave a professional job, and expansion would allow her to work and earn more.
Hi, my name is Anna Hauser. I live in Madison, and this is my son Xavier. He's a 13-year-old, and he has cerebral palsy. Because of this, his brain doesn't tell his muscles how to do what it needs to do correctly. And because of that, he requires extensive care to meet basic needs. Xavier, his 2 siblings, and I moved to Madison 4 years ago. When we moved to Madison, we chose this location specifically because Madison has extensive medical professional need to meet his needs, as well as it's a really inclusive community. I mean, we've built a home here that we really, really love. But unfortunately, not long into our time living here, I had to leave my job. I have a degree as a medical laboratory professional. I worked in that field for 7 years. But for the last 4 years since we've been here, we have been missing one critical piece to our family's financial independence and our security, which is direct care workers. So in my field, I would make an average of $23 an hour in the state. Right now, I'm working every other weekend, making less than half of that. I know. Xavier agrees. He said, with no one to care for my son, I'm no longer able to work in my field. And I've looked for other jobs. I've looked countless hours for jobs, but there's obviously there's nothing there for somebody who has restrictions telling them they can only work between the hours of 9 a.m. and 2 p.m. There's just nothing like that, and there's nothing like that, especially in my field. I find joy in being able to go to work, and there are people who would say, hey, you've got a medically complex child. You absolutely could stay home. You should stay home. He needs you. That's totally justifiable. But I am a really independent person. I really enjoy working, and I also don't like living hand to mouth with my children. So I would like to be able to go back to work. That's something I'd really like. My dream right now is to find a caregiver by the time my son graduates in high school. That's 7 years, and it's a pretty sad, measly dream that if we're keeping count, that would be 11 years from the time we moved into the state till the time he would receive a caregiver that would allow us to actually have me go back to work in a profession that would actually support my family. During that time, that 11 years that we're counting, I could maybe be able to afford a car that would transport my child in a wheelchair. Right now, we use a bus, and the average trip that we take is about an hour and a half one way. So you're considering for one appointment that maybe is 30 minutes, that we're traveling 3 hours in a city that we live in to attend it. And other things are living in a place that's fully accessible. We could maybe save up and buy a house. Those are things that people dream of, people want, lots of people have. But because of where we sit with the caregiver crisis and because of my restrictions as far as working, we simply can't realize that. We're stuck in a situation where we can't get out of it, and we want to. See? So the average worker makes more working in a coffee shop than they do taking care of my medically complex child. Not only that, but in a coffee shop, working full-time, those people can get benefits as well as paid time off. Wisconsin cannot say that for their direct care workers. They do not get benefits and they do not get paid time off. At the beginning of 2019, we actually did finally find somebody to meet 2 of our 5 days that I need to be able to go back to work. And yesterday was her last day. So she was a great person. She was very kind and very reliable. And that's a pretty rare situation for most care workers in the state of Wisconsin. But now we're back to square one. If Medicaid were expanded, it would benefit my family in the immediate, as I would be able to at least work a couple more hours to bring home more money for my family while keeping health insurance. I'm begging you to consider the economic cost of forcing parents like me, who could and would work more, not to. Consider the social expense of forcing 3 children to live in poverty and the statistics surrounding those who grow up in a situation like that. My family is just one of thousands of casualties that are being taken from families who, from the situation where Medicaid is being refused, the expansion is being refused. Please take a second look at the facts. Excuse me, and help us to succeed, because we desperately want to.
Thank you, Anna and Xavier. Thank you to all of our speakers today. I am going to wrap this up. I'd like to have that visual right there so we can make a point. All the stories you heard today, all the needs you heard today are funded with Medicaid expansion dollars. $29 million in increased workforce wages for family care. $17 million in increased worker wages in personal care. $48 million in increased reimbursement for dentists. Another $74 million in children's wait list services. $118 million in mental health supports. All of these needs you heard today are funded with Medicaid expansion dollars. 37 other states have already taken Medicaid expansion. They get a 90% match. Wisconsin gets a 60% match. Think of what we could do with those additional dollars and help all the people that we heard from today. Medicaid expansion in those 37 states has been studied and studied again. There are 200 research articles about how Medicaid expansion works in other states, and I'm going to tell you the facts. States expanding Medicaid realize budget savings, revenue gains, and overall economic growth. States that took expansion dollars did not see significant increases in spending of state funds on or other significant reductions in other areas like education or transportation. In some states, expansion resulted in state savings by offsetting state costs in other areas, including behavioral health services, the criminal justice system, and supplemental security income. Studies also show that Medicaid expansion in states result in reductions in uncompensated care in our hospitals. Expansion states experience more job growth, including in health sector jobs. People in expansion states are healthier than in those states that didn't take expansion. Private insurance rates did not go up in expansion states. In fact, there's evidence of a 7% rate decline because the healthiest, youngest people stayed in the marketplace, while others more likely to drive up costs, sicker folks, were more likely to go into Medicaid. Rural areas experience most gains in overall insurance coverage. Expansion states have fewer unpaid medical bills, and people covered by expansion experienced less out-of-pocket costs and had fewer worries paying their medical bills. For these reasons and more, for the stories that you heard today, we think Medicaid expansion makes sense. It is essential for our legislature to consider the facts and, more importantly, to remember all these faces today. Thank you for coming. Thank you to our speakers.